Hi, everyone. Thank you so much for joining us. My name is Amy Braun. I am the CEO and president of HealthCorps, and I'm so excited to welcome you all to our very first podcast called Healthy Chats. We launched this podcast to really be able to discuss some of the most relevant issues facing our students, our communities, and the country as a whole. We're really about bringing together experts in a various number of health fields to help bring you some of the most up-to-date, most recent news as we tackle these health issues across the country. With me today, I'm very excited to mention a few special guests. We have a member of our HealthCorps Board of Directors, Dr. Pedram Salimpour. He is a pediatrician and the CEO and founder of Pierce Health Solutions, focused on the creation of novel health delivery systems for Native American tribes. He also serves as president and twice appointed commissioner of the Los Angeles Fire and Police Pensions Board, managing over $19 billion in assets. Dr. Salimpour recently completed his term as the 143rd and youngest ever president of the Los Angeles County Medical Association. Welcome, Pedram. We're so happy to have you.
Thank you, Amy. Thanks, everyone.
We also have with us Jared Flam. He's the vice president of growth for Kinsa Health. He previously served as program director for Kinsa for Schools, overseeing Kinsa's Fluency program. Fluency is a nationwide health initiative that provides Kinsa health tools free to thousands of school communities across our country. Welcome, Jared.
Thanks, Amy.
Next, we have Carlos Quintero. He is the athletic director and an educator at Sharpstown High School, which is a Title I inner city school located in the southwest area of Houston. Over 90% of Sharpstown kids are on free or reduced lunch and come from all walks of life. HealthCorps has operated its program at Sharpstown for several years. Welcome, Carlos.
Thank you, Amy.
And last, but definitely not least, we have with us Jacqueline Miller. She is a HealthCorps coordinator at Purcell High School in Purcell, Oklahoma. She is a native of Kenton, Oklahoma. She graduated from the University of Oklahoma with a bachelor's in health and exercise science and worked for the athletic academic department at the University of Oklahoma for 2 years as a professional nutrition tutor. And we are very excited to have her with us today as well.
Thanks, Amy.
Wonderful. So today we are actually going to tackle the issue of school openings during the coronavirus and how do we do this safely? What do we need to consider for our students, for our teachers, for anybody involved in it, both from the side of the medical opinion, the academic side, and student health side. So we're really excited to delve into this conversation. First off, I'd like to talk a little bit about the situation that is facing our schools. So I'm going to turn to Dr. Salimpour first and ask him to talk a little bit about what are some of the major medical and public health concerns that we need to be considering as parents as we think about reopening our schools.
Thanks, Amy. Everything that we do in medicine has an upside and a downside, right? There's the term side effect is in the common vernacular. So there's nothing you're going to do that's going to be without its own problems. So staying at home has its problems, and then going to school has its own problems. We know what staying at home is like. Parents have a difficult time being teachers. Parents love being parents. They didn't sign up to be teachers. Being a teacher is a very difficult, very complicated task, especially when you add on top of it the stuff that Jared is an expert in, the technology. And most parents aren't experts in technology. Most teachers aren't experts in technology. And now all of a sudden we're asking everybody to be both of those things. So that's complicated. But then going to school also is going to have its challenges. Today is the first day of fall, so happy first day of fall to everybody. But unfortunately, we've seen over the course of the past 10 days, a 15% spike in the number of cases in this country that coincides with a whole lot of things that come with fall. People are outdoors less. They congregate in groups more often. Going to school exacerbates that problem. Not necessarily for kids, because kids we know are extraordinarily resilient. Kids do well in general in almost all circumstances. But kids aren't at school by themselves. They have teachers and administrators and janitors and all kinds of people that aren't kids who may have comorbid conditions, and then kids go home to their parents and grandparents who also have comorbid conditions. So if we're going to open up schools, which I think would be a fantastic idea, we have to do it thoughtfully and carefully and do it in the way that puts to use the entire armamentarium of technology and everything else that we have at our disposal today that we didn't have just a few years ago. So making sure that kids are separated, making sure that HVAC systems are up to par, making sure that there's technology deployed that checks kids' symptoms every single day before they go to school, parents too, so that we don't bring infectious diseases, including the flu and the common cold that can be confused for COVID into the school environment and spread those. So there are challenges, but I think those challenges are surmountable in the year 2020 in the way that they might not have been able, we have not been able to overcome in the year 2000 or 1990. So we should use all the tools that we have at our disposal, thanks to technology and everything else, to get kids back to school as soon as possible.
Excuse me. Wonderful. Well, I definitely want to touch on technology in a little bit. And I can say from personal experience as being a teacher is hard. It is challenging in a regular year. And when I was there, I was definitely not an expert in technology. I think I've gotten a little bit better, but it is a very hard job. And you layer on the conditions that we're facing now, and it becomes even more difficult and more emotionally challenging for many of our teachers. So I'd love actually now to turn to Carlos. If Carlos, you could talk a little bit about what your school is doing to keep students safe, and what's going on the ground in Houston.
Sure. I think just to echo, like you said, the technology barrier is not just in our community, but in a lot of our staff. Luckily, our district, Houston ISD, and our campus, we have some great technology experts where we have, we are lucky that we are one of the schools that we are one-to-one. So that means our kids actually already had laptops. So our first challenge was getting the freshmen their laptops. So we've deployed, I believe, up to 90% of the freshmen have their laptops. We've implemented several, just different ways to reach out to these, to the community. As Dr. Salampour mentioned, parents now have to be tech savvy with just as much as the kids. So I think, that has posed a challenge that I think we are facing pretty well. We, as a district, are not face-to-face right now, so we are in a 6 weeks where we are virtual until October 19th. That being said, we, as a district, do have athletics after school, so that's kind of the, I'm not going to say guinea pig, but that's going to be like our how is it working? Can it work? As Dr. Salampour said, bringing everybody back is going to be a challenge. I talked to our principal. We have a small group, the football players and the volleyball players back in school. But right now, we are changing the classroom setup. Rooms only have 12 chairs, 12 seats. So that's also, as he mentioned, a lot of the obstacles coming back. What does that look like? Can we bring everybody back and do it safely? So I think those are the big issues. I think our district is doing the best that it can. Over hundreds of thousands of kids. It's a challenge, right? And every day something new happens. Technology may not be working, but just like the kids, the teachers need to find solutions. We need to find them quicker, and all the while doing it virtually. Right. So I think that's kind of where we're at.
Wonderful. Thank you. And I'd love to turn to Jacqueline, who actually is in session in Oklahoma. So Jacqueline, what are some of the things that you're seeing taking place in your school? How are they prepared for the, the pandemic? What's taking place on the ground for you?
First off, I apologize about that. I am in a school and the bell just rang. But yeah, so my school has been in person since about mid-August. Coming back, there was some hesitancy and some anxiety, but I'm very proud of our school so far and how they've handled it. As a teacher, seeing the teachers out and I see their struggles, I see how hard they're working to really enforce these rules and to instill the value of following social distancing and those types of rules in the school. We have limited class sizes as well, and everyone is required to wear masks at all times, except for when they are eating and drinking in the lunchroom. But we did have to create kind of an A-B lunch schedule where we never had to do that before, to limit the number of people in the cafeteria area. And so that was all the school district's planning. So they've implemented it very well. My primary responsibility and my goal since I've been back has been just to educate as much as I can about what COVID is, how to prevent spreading it, and where to get testing and those types of things if you do think you have COVID. Because the number one thing that I'm seeing in my school is that there's a lot of misinformation going around and a lot of confusion with the students. So I'm just really trying to work with the administrators as well as other teachers to make sure we're on a unified front and all have the same information when it comes to addressing questions about COVID.
Wonderful. Thank you, Jacqueline. Well, it's wonderful to know that you're on the ground. And I actually have gotten the pleasure of seeing some of the work that she's done with really spreading, a mask wearing campaign, promoting it. Why do we wear it? Really trying to create that culture on her campus, which is just part of the wonderful work that HealthCorps does. Carlos, before we switch, I just wanted to touch on a question for you about sort of some of the maybe financial barriers that schools are facing, trying to get themselves prepared for the pandemic and to create their schools safely. But of course, we know that school budgets are facing a lot of constraints as tax revenue has decreased, and just kind of wondering if you're facing any of those financial concerns as a school system. And, as you prepare to bring athletes back, as they touch one another, what are some of the ways that you're working to try to, keep the symptoms from spreading or, maintaining the pandemic?
Right. We obviously follow the UIL and HISD protocols, similar to like what Jacqueline was mentioning, like when our kids come in, we take their temperature, we social distance as much as possible. We wear a face mask when we're indoors, lifting weights or, just doing some activity when we're outdoors. Obviously, it's a little more, we allow a little more things, but we follow that protocol. So on a daily schedule. And so, I don't know if I know there's budget constraints, but I've, working in an inner city school for 10 years, we have been successful in finding partners and finding what's necessary to get through some of these constraints, if you will. And so, one of the things that obviously Sarah had reached out to me with Kinsa, and Jared mentioned some of that. We are going to join their program where we will be using their technology to try and, before they even get to campus, monitor and see kind of what the, they'll have their thermometer and such at home. Well, they'll be able to measure that and we'll be able to track that even better than at the point of contact at the school. We have one point of entry. And like I said, kind of like echoing what Jacqueline said, the key thing is getting these kids to understand, the importance of social distancing and why we need to do it, and further educate them on, for now, that is in our best interest in trying to return to normal. And, like I tell them, everybody's watching what we're doing. So if we can't manage to do it, how are we expecting 1,700 kids to do it? And so that's a big key. And then, like I said, I'm not going to harp on this budget-wise. If you know anybody, we're always looking for help. But like I said, the other thing is, along with these partners, I'm a Rice University graduate, so I've had friends from Rice that know our story and have been very instrumental and helpful. So we kind of, like everybody, find partners, find people that know our plight and are willing to assist us in doing the best we can for kids.
Wonderful. Well, you just put the segue in there for me excellently. I'm going to turn to Jared in a second to talk about the program, but I just wanted to briefly share with everybody the program, Carlos, that you're talking about is the HealthCorps Save the Students campaign. And this is something that we've partnered with Kinsa on to actually we're trying to bring 10,000 safe student kits to students across the country so that when schools open, like Carlos is in Houston, they can open safely. These kits are really an incredible resource to our underserved schools. They include reusable masks. They include connected thermometers for families, which then work with the Kinsa app, where we'll have Jared speak shortly about that, where this app is what Carlos and Dr. Salampour were talking about, providing the symptom monitoring, providing these resources to schools to really try to prevent an outbreak and keep individuals safe. And of course, we will also be providing our HealthCorps resources to a large number of schools across the country. And this kit, as Carlos mentioned, was really meant to come together to level the playing field. Whether you are in a low-income school or you're in a high-income school, kids across the country should be able to go to school safely if that is the decision that our administrators and our schools decide upon. And that's really the hope behind these kits and why we've partnered with Kinsa is to really level the playing field and make sure that every student has an opportunity to learn in person safely. So Jared, I'd love to turn to you quickly if you would want to share a little bit about the Kinsa app and how it works. And, I know Fluency's been in schools for a while and kind of, why we work together to prevent the spread of the pandemic and the flu as well.
Yeah, absolutely. So I think firstly, going back to that initial question, there's this big issue right now around how do we reopen schools? That's, kind of point number one. But there's also the issue of, once you reopen schools, how do you keep them open and manage to do that in a safe fashion? And so just speaking about our Fluency program in Kinsa for a moment, Kinsa is really focused and has the mission of helping individuals and communities stop the spread of infectious illness through early detection and early response. And so over the past 6 years, we've been running a program that we call Fluency with a capital FLU, because really it was designed for flu, but it's now very helpful in the context of COVID, where we give this early detection system to schools. And so the way that it works is we arm school families with the support of the school administrators with free smart thermometers, which connect to a smartphone app so that if I'm a parent, I can take my child's temperature every day, I can input symptoms, and I can go through a screening on whether my child is safe to go to school without spreading the illness to potentially other students at the campus. From there, we aggregate those data insights and we provide that anonymous information back to the school district and the school administrators so that they can make more informed decisions. So for example, if I am a principal and I notice that illness levels are high, I can take the right interventions, whether that is increased disinfection or a remote learning strategy that might make sense in that context. And so what I'm really excited about here is that via the Save the Students campaign, we're able to provide this system through the generous support of HealthCorps and others to more schools, and really not just allow schools to reopen, but hopefully keep them open throughout the whole school year here.
I love that. I think that's a great point. It's not just about opening them, but keeping our students safe throughout the year as the pandemic changes and adjusts. I'd love to turn to Dr. Salampour, because Dr. Salampour also has created a technology that he's currently using, an app as well, to help prevent the spread of COVID as well. So I'd love, Dr. Salampour, if you would talk a little bit about that and the results that you've seen on the ground and how effective it's been, what you think about technology in the classroom.
Sure. Our program is a little bit different than Jared's, so we're not in any. Right. I think they have a brilliant program that they've deployed for schools, and it's done extraordinary work in keeping schools free of disease, not just through COVID, but before also. So congratulations to you, Jared, and your team. What we do is a little bit different. The idea was that 6 months ago, Jacqueline and Carlos only had an on-off switch for their school, right? Schools could either be on or they could be off. What we decided that not just schools, but businesses across the country and hospitals and everybody else needed wasn't an on-off switch, but a dial, because things were not going to go back to 100% normal for quite some time. So what we have armed businesses and schools and others with is a very comprehensive program that includes testing. So we have a saliva rapid turnaround RT-PCR test that's 100% sensitive, 100% specific, which means the true positives are really positive, the true negatives are really, the negatives are really negative. That allows schools and businesses that get back to school and stay in school. Now, nothing is going to be 100% for a while, right? We're going to have little scares, we're going to have little spikes, but there is incredible news. The incredible news is that Kinsa, through Jared's company, our company, Bluestone, and we're not the only ones, there are others too, that have been incredibly innovative in working to deploy technology and then the bleeding edge of the science of medicine to be able to get teachers and students back to school and back to work as quickly as possible. Again, taking away the concept of an on-off switch, a giant on-off switch, and putting in place a whole bunch of dials in their place. And then also, I think it's worth saying, and this shouldn't give anybody a whole lot of comfort, but the risk of dying from COVID is 30 to 50% lower than it was 6 months ago. So it's not just the us that are working. By us, I mean Carlos, Jacqueline, Jared, myself, others on the front lines, but others in the laboratories and the science of medicine working to keep patients from getting sick enough to not make it. And that's a really big deal. So again, I think that a combination of temperature checks, as Jared alluded to, a combination of social distancing and knowing when and where to bring the students and teachers into the classroom, as Carlos and Jacqueline alluded to, and testing can really get all of us back to school and keep us in school for as long as possible, and keep families at home and teachers at school safe also.
Wonderful, thank you. And thank you for sharing a little bit about your app. I know it's seen, Bluestone has seen a lot of success, so it's wonderful. And we're excited about the Fluency program coming to our schools. Jared, are there future technological advancements for your app in specific, or other types of technologies that you'd like to see available to schools, as we look to, continuing the success with Fluency and abroad, as we look to open schools, not just today, but in the future, to keep our students safe?
That's a really great question. So, we're based in San Francisco, Silicon Valley. So it's every day that there are 100 new apps and tools that are being developed. And I think everybody has seen the seriousness of COVID-19 and that these types of tools need to be developed. In my mind, the advancement, especially, to be helpful for schools, is how do we make these different technology solutions interoperable, meaning that they exchange information between themselves. So as we heard before, there's several different apps. How do we allow them to talk to each other so that if I'm a school or a school district, I don't have all of these different isolated solutions, but I have the data right in front of me that's going to allow me to make informed decisions. And so I think to technology firms, the big ask right now is how do we work together to support schools or to support communities and employers instead of in these isolated use cases. That's the advancement that I would like to see personally come about over the next 3 to 6 months here.
Wonderful. And Dr. Salampur, I'll ask you the same question, as I know you work in a lot of health-related technology. If there's anything, whether it's now for COVID or anything you'd love to see in the field of healthcare and technology, before we turn to a little bit about the human component of the pandemic in schools.
Sure. Jared said it, but administrators, CEOs, teachers need an air traffic control sort of a system. If you're an employer, you need to know where your employees are. If they're sick, when can you expect them back to work? If they're not sick, but they're being quarantined, when can you expect the student to come back? When can you expect your teachers to come back, right? So what Jared was talking about is a very brilliant idea of an air traffic control concept where the people that are managing these large systems, Carlos, Jacqueline, others, can anticipate and plan for the students that are going to be in the classroom, the teachers that are going to be in the classroom, and the other employees that come and go. That's very, very important. Unfortunately, today, that technology needs one other very, very important piece, and that's testing. Because unlike all of the other infectious diseases, or most of the other infectious diseases that we've seen, and we've seen a lot of infectious diseases. This isn't the first one, right? We've had H1N1, we've had Zika, we've had Ebola. Unlike a lot of those others, there is an asymptomatic period where you're not going to show up on any of these apps and you're not going to show up on a temperature check, but you are going to be infectious. It's a small number, but it's big enough to be a problem. So we do need testing as part of this armamentarium if we're going to be safe. Now, do we need to test 3 times a day like the White House does? Do we need to test every day like the NBA does? Not clear. Every organization is going to have to make up its own mind about that. But testing is going to have to be deployed as part of this armamentarium of the app and the temperature checks that Jared was talking about, the air traffic control, the HR management tools that he alluded to, and testing. And that is a crucial component of this system. And I think we're getting better at it. Tests are going to get cheaper. They're going to get faster. They're going to be more accurate. They're going to be less corrosive, right? When was the last time you had a throat culture done? It wasn't fun, right? Now imagine that thing going up your nose. That's horrible. It's horrible. And it's operator dependent. So now we're getting good at saliva tests, right? Any 2-year-olds can spit. We know that well. So anybody can spit into a little cup. So everything is getting better. But remember, this is a very insidious virus. Just imagine this. 6 months ago or 9 months ago, one person in China got this disease. One person. It started with one guy, and now it's all over the planet. So we have to work very, very hard to put that genie back in the bottle. And it's going to require a whole bunch of public health tools, technology, and the science of medicine and testing.
Wonderful. Thank you, Dr. Davenport. I think you bring up an interesting point as we kind of look at the breadth of this disease and the emotional toll that I think is accompanying it. So I know, there's a lot of research out right now that mental health has been increasing, mental health issues have been increasing in the United States and I believe around the world as well. But as we kind of all grapple with the size of this pandemic and the isolation that's been associated with it because of social distancing and trying to keep everyone safe and the added anxiety. So I'd love to actually turn to Carlos and see, what do you see the issues that are facing your teens today as they grapple with, being isolated and being, at school virtually? Have you seen some issues arise with the teens that you serve?
Well, as a matter of fact, so like yesterday and today, we've canceled practice due to the weather, right? Beta, the wind, the rain, some flooding. And my kids have been messaging me and like, Coach, are we practicing today? So, I think they've been, let's just say, cooped up for so long that they want to return, right? And like, Jared and Dr. Davenport had mentioned, it's how can we make it safe for them to return? Because, I've noticed our kid, like I said, our kids know they want to be back if it's just because they've been, in the home for so long. But, finding a way to bring them back has been obviously is the big issue. I have found that, I have kids that seem to be taking it okay. And then, there's my other cases where, parents don't want them to come back. So they're kind of like, well, coach, how can you convince her? And I'm like, well, again, we're working together. I'm not going to convince your mom or dad to do something that they don't want to do. So that's been the other challenge, right? Kind of like Jacqueline said, keeping not only kids, but parents informed that what we're doing and how we're doing it is enough to safely bring them back onto campus and bring them to some sort of normal. As the athletic director, I've told every coach that if you're not bringing kids back to campus to just return to normal, but instead you're looking for championships, I think we're looking at it wrong. Athletics right now is how it has always been a vehicle to assist in the academic endeavor of the student. And that's what I'm telling, at least that's how athletics is functioning at Sharpstown, in that with the assistance of, our nurse, our principal, our coaches, we're trying to show that we can do this right, and that through athletics, through, co-curricular activities, we can bring back the academic and keep up the academic rigor, if you will. So as I said, I've got both sides. I've got kids that are handling it really well, even better than I would imagine. And then some of the kids that are struggling with, being at home, the technology, the new school, right? We just got to every day keep finding new ways to get them back and give them an opportunity to get back to campus and stay on campus.
Wonderful. Thank you, Carlos. And I think you bring up a really, really salient point. That's something that's been troubling me is, as many kids are going back to school, it's lovely that you guys are still doing sports, but I know many public schools across the country and private schools across the country that won't be doing sports, or are students that aren't taking PE anymore. And obviously HealthCorps being very, invested in making sure that our kids are active and physically healthy. One of the things that concerns me is without PE and without sports, what type of physical activity are our students doing? What is that doing to their health? We already know that there's a lack of green spaces in many communities. And so limiting their access to such activities and limiting, being stuck inside all day, really concerns me about how is this affecting their physical activity level, which we know down the road leads to many different, can lead to many different types of chronic disease. So Jacqueline, I know you're back in session. So how are your students doing, mentally and physically?
Just from talking to the students that I interacted with last year and meeting the new freshmen this year, one of the first things that I did in my classes was survey them and ask them questions like, how did you handle this transition so abruptly last year? And many of them are very anxious and very nervous about what is considered right and wrong right now, and whether or not their actions are going to harm others. They also, I think, are very unsure about their future, especially in the upperclassmen. So as you guys probably all saw, the seniors last year, their whole plans basically got wrecked. And so our new seniors this year are worried, like, is that going to happen to me? What does this mean if I decide to go to college or join the workforce? So I'm seeing a lot of uncertainty and questions that no one really has the answers to. I also am seeing a lot of students who struggled with isolation while they were in quarantine and when we did have to switch to distance learning, because as we've talked about, all of those extracurriculars, whether it be sports, band, art, clubs, whatever it is, they got shut down so abruptly. And many students rely on that for their mental and social well-being. And now that we're back, those activities, some of them are in person and some of them haven't been able to return to any form of normal. For example, in my school, one of the things that I loved the most about last year was doing a yoga club. And so I have kids every single day come up to me, are we doing yoga club? Are we doing yoga club? And I have to tell them no, because sorry about that. But I have to tell them no, because we're not allowed to have students congregated in a small space. And I used to do my club in the library. And so I'm also not allowed to share things such as mats and materials, whereas once before it was very interactive. I could really get in there and work with the students, get to know them. And it's heartbreaking for me that these kids don't have that sense of connectedness that they had previously. And so that is one of the major issues that I'm seeing with my students is there's a lot of fear and anxiety about the future and their current actions. And then they're also feeling very isolated and distant from each other, because even in the classroom, whenever we try to spark up a conversation, they're sitting 6 feet apart. And so I've noticed when I try to talk to my students, I feel like I'm literally shouting at them because they're so far away from me because of social distancing. And so even when we're in the classroom, that discussion period, which I think is really, really valuable, is even being strained. Even though we are in person, there's fewer people and we're still mentally, I think, and physically spaced out because of everything that's happening.
Thank you, Jacqueline. And I know, that's a great point. And I know that as HealthCorps, we've really been looking at and doubling down on the mental health resources that we are providing our kids, helping them, understand what's happening underneath the surface. Teenagers are co-communicators. So they're very, very reliant on one another to help them process their issues and their feelings. And so when you separate them and you've really removed a lot of that physical contact and you've really limited communication to their social media, we know that that can really add to stress, add to anxiety, and that those elements can really add to depression. I want to turn to Dr. Salenpour to kind of talk a little bit from his perspective about what some of these issues do, to mental health for our students, because we've seen at HealthCorps that, that there are increased levels of anxiety, there are increased levels of depression, and this is in a population that is already experiencing record high numbers of suicide and depression and things that are facing this teenage community. And now you layer on the feelings of anxiety that Jacqueline mentioned, and the mental health just seems to be something that we really need to be considering when we think about bringing our students back to school. So Dr. Salenpour,
Yeah, Amy, I'm so glad you brought that up. And Jacqueline, I'm so glad you touched on that. Hope is a huge determinant of your mental health. If kids feel hopelessness in this situation, it's going to be an absolute disaster. So I think that what I would love to do is every day give kids a glimpse of why the future is incredibly bright. A new advancement in the science, a new development in technology, a new step forward in our being able to contain this virus. Something that gets them bought into, wait, every single day, there's a scientist in Boston or a brilliant technology person in San Francisco or somebody in Houston taking a step forward to getting us back to normal. That, I think, is going to be a very important part of getting kids feel like, okay, this is temporary. Anybody can deal with a bad temporary situation, but if you feel like this is it, you're stuck in this rut forever, that's no fun and causes and is going to cause all kinds of disasters. Let me just bring up one other thing that I'd love to get the educator's perspective on. Look, when you're in a classroom, you're sitting down with 20 other kids and you're facing forward. If you ask a question or if you answer a question, the teacher hears you, but you're not front and center every single time with all of your classmates. With Zoom, as soon as you raise your hand or as soon as you called on, all of a sudden this 13-year-old girl or boy who's already incredibly self-conscious is a giant person on a screen, and you can't hide. You can't be anonymous in that moment. It's like being called up to the front of the class every single time. So how do you how do you deal with that? How do you give kids comfort that this is, look, it's not, I mean, I don't know the answer to that question. If it were me as a 13, 14-year-old, and every time I spoke, I was in front of the class, I would be nervous. I'd be uncomfortable. And that's what Zoom does.
Absolutely. Carlos, do you want to take that? And then Jacqueline, if you guys have any thoughts.
It's interesting. Every day I think about this because, like you said, Zoom, we use Flipgrid. So Flipgrid is an app where you create videos. And when we first did it last week, I had several kids message me and say, Coach, do we have to show our face? Like, why are we doing this? And so, it didn't occur to me until obviously I was actually doing it. Because kind of like me, I'm like, what do you mean? You don't want to be front and center? But it's also, the way I've always taught and coached, I try to show them that, look, even though I may be considered an expert, I make mistakes, and this is part of the way you're going to learn and become a better person overall, right? So gradually, it goes back to also connections, right? Making the right connections with kids. So sometimes I jump into things really quick. As a coach, I'm like, come on, just get in there. And then I got to throttle it back a little bit and understand, like you said, okay, these quiet, shy kids, how do I connect to them so that they understand that it's okay to be shy and to try. So I haven't answered it yet because out of 35 Flipgrids that I should have, I only have 30. So 5 of them said, well, can I use a picture or just not go live? So, obviously finding ways, and I said, sure. So this first one, I gave them a little break. And I think that's the key, like you said, finding innovative ways, new ways to make it normal. And, as I say to them, unfortunately, I can't, you can't stand up in front of the class. So this is kind of our standing up for now. And, I'd say just trying to make it as normal and as fun that you can, but I haven't answered that yet. So I'll figure it out. Jacqueline?
Thank you. So yeah, that's kind of a loaded question, but there's a lot of good things and a lot of different tactics that I've noticed. As he alluded to, you really need to get to know your students too. So one of the things that I like to do in my classes that I'm going to be with for a long period of time, whether it be a school year or a semester, is to have them take like a quick little personality test, because something that I tend to be a little bit more introverted. And so I, kind of gravitate towards those students, but the extroverted students, they might think I'm kind of boring. But getting the gist of like how your student body and your population is will help you interact with them too, because whether it be through Zoom or in person, if I am trying to spark up conversation and 90% of my class is an introverted class, like that's going to change the way that I approach it. And so one of the things that I've been doing is really having little icebreakers where I ask them a very simple question, but tells the class a lot about them. So this morning, actually in first hour, we are discussing nutrition. And so the icebreaker was, tell me what your favorite food is and why. And so very simple question, but you learn about those kids. You learn about what they like, the types of foods that they eat.
It's okay, Jacqueline. It's nice that you're in a school. Don't worry about it. We're a place that we all wish we could be, and probably many other students wish that they could be in the schools as well, with the bells ringing again. I know it's music to my ears, so no stress there.
All right. Sorry about that. It's picture day. They were calling more kids down. But yeah, so the icebreaker we did today was, what's your favorite food and why? That's a very simple question, but it tells me as well as their peers a lot about them. It can talk about their culture. They can talk about the things that they enjoy, the stuff that the places that they go. And so helping them find those commonalities amongst themselves is also good. But it teaches me a lot about them and how to cater what I'm doing to best fit their needs. So I mean, there's a lot of things that could go into that, but I really just figured out that learning what your students respond to and the things that they enjoy, that's the best way to make them feel safe and included, I also instill in them my number one rule is respect when I'm in the classroom. So respect yourself, respect the teacher, and respect the people around you. Because as we all have mentioned, like, I really want them to feel free to say the things that they think are right and to make mistakes, because through making mistakes, you do learn things on a deeper level. And so I really want them to feel safe with me and talking with their friends and classmates when it comes to especially things with health, because things can be a little bit tricky and like kind of awkward to talk about sometimes. So I don't ever want them to feel afraid to talk about what they're dealing with. And so making them feel safe, getting to know them are probably the best tactics that I've learned. But I mean, it's something I am constantly adapting every single day.
Thank you, Jacqueline. I think, you bring up an interesting point, both Carlos and Jacqueline, to Pedram's point about how hard it is to try to create those connections virtually. So when you think about, I actually wasn't a student who would raise my hand so quickly. I wanted to make sure I had the right answer, that it was perfect before I responded. So that was something that I was cautious about as a teacher when I went into the classroom. And, for me, it was about physical interaction with my fifth graders, right? So understanding, as Jacqueline mentioned, who your student is, creating those connections. And that's very challenging on Zoom. As an educator, I don't know how I would have done that, and making sure that you can look over a student's, shoulder and make sure that they're on the right track without calling them out, without making them answer a question when maybe they don't know what the answer is. And, oftentimes in a classroom, as I'm sure many people know, the same students raise their hand. So, what's happening on Zoom, if you can't see if the student has the right answer, or you want to, try to bring in another student, if you can't see what their answer is, it makes it difficult to call on them without potentially embarrassing them or, harming their emotional self-esteem. So I think it's a great point. And, at HealthCorps, one of the things that we've been trying to do over, the last few months since we shut down in May is figure out how we create these social connections. How do we bring back the art? How do we bring back the lunchtime interactions? How do we create those emotional connections that are so important to teenagers, to make sure that they're still getting some of those benefits that are so important to them, that then translate into the classroom, that help them have self-esteem, help them, maybe want to raise their hand, but, really trying to create some of those connections to make them feel a part of their school, and to make them feel a part of the work that we do and to help their physical and mental health. I think as we think about what Carlos and Jacqueline said, it really just raises, so much of the importance of, opening schools. And, we know the value of schools, right? And we know that there is such an important element that physical interaction plays for all humans, right? All of us right now are suffering with social distancing. And so I really think when we think about Save the Students, and why it's such an important part of what HealthCorps is doing, is because it's about bringing back our schools, about making sure that when students and families decide that they want to go back to school, that they have the right materials to do so. They have those reusable masks. They have that connected thermometer. They have, real strong feelings that their school and their city has their best health in mind, both from the teacher standpoint, the student standpoint. That we're really looking at this problem cohesively. And that's really what the goal is of Save the Students, and why we believe in these Save the Student kits is we want to get our kids back to school. As everybody on this, Zoom has mentioned how important it is. And, as people across the country and educators and, politicians and doctors, have mentioned how important it is. And we just really believe that by providing these tools, especially to our at-risk communities, we're leveling that playing field. We know that our at-risk communities these students actually need to be in school even more so, that we're actually seeing higher dropout rates associated with some of our at-risk schools when students can't get back into the classroom. And so, we want to make sure that no family, no student needs to make a decision between putting food on the table and buying a reusable mask. Having shelter over their home, or making sure that they can take their child's temperature every day so that they can feel confident about them going to school. So this is really, some of the work, and why we put this panel together is to really show that when people, decide that it's time to go back to school, the government and the schools and the administrators, when they make that decision, HealthCorps and Kinsa want to be there to make sure that our kids are doing so safely, that our teachers are safe, that our administrators are safe, and that school can really provide that connection that that Dr. Salimpour brought up, and Jacqueline and Carlos really spoke to, that we can come back in a way to provide all of our students with the most academic healthy environment that we can provide. So as we sign off, I do just want to give everyone on the panel a little bit of time to talk about what is how they envision the new normal in their world, and what they're looking at is for the next few months in their fields with COVID. Jared, do you want to start?
Yeah, sure. I think that the new normal in the technology field is, how do we tackle this? How do we help? How do we support? I think that Save the Students is a great campaign. In our work at Kinsa, we've seen that 40% of school families don't have access to any thermometer at home, which is a very, frankly, scary thought when you're thinking about children going into school and potentially infecting others. And so the focus is going to be on COVID-19, and especially as it starts getting conflated with influenza this year, and how do we help support?
Absolutely. Dr. Salimpour?
Thanks, Jared. I think that the new normal is going to be incredibly exciting. The marriage of technology and medicine is something that we've been trying to bring together for a very long time. But COVID accelerated that. And that is an incredibly exciting part of what I do, both philanthropically and professionally. And it's the brilliance of people like Jared that have been able to bring these two worlds that never talk to each other together. But I think that personally, I do interviews for medical school, and when you interview medical students, a lot of these kids have hopped from triumph to victory, and those are never attractive students to me. To me, the attractive student is the one that has failed at some point in his life, had some kind of major problem, and has been able to overcome it. And that resilience, I think, is something that educators like Carlos and Jacqueline can really instill in students in this particular time in a way that may have been much more complicated in times past. So I look at this as an incredible opportunity to help kids build these resilience skills that HealthCorps is so involved with, that is so central to HealthCorps' mission. Resilience, mental and emotional resilience are so important. And I think this is a great opportunity to instill those skills in all of our students and everybody else too.
That's a wonderful point. Thank you, Dr. Salimpour. I think, as we look to the future, really making sure that our students, feel supported. And I love the idea that, how do we use this as a way to help them see their strength, right? To help them succeed in the future is something that they tackled. And I think that's a mindset that really all of us can use for this past year is how do we use this experience to help us grow? Carlos, do you want to share any thoughts about the new normal for your world?
No, I think, that's exactly right. Like, how do we, with this new technology and all that, how do we implement that into our school, what we've already done? And then, as Dr. Salimpour said, how do we continue to use this to further make our kids' educational experience not only more innovative, but just how do they become part of the solution and not the problem, right? So becoming difference makers and realizing, look, there's all this technology, and in our community, realizing, one of the things that there's people out there that want to help our community. And so having these kids understand people are out there willing to help us. So how do we make this work? And how do we, as the next generation, as Jacqueline mentioned before, how do we not happen what 2020 did happen for the seniors and have, new ideas, new growth on getting back to what we all want? And so I think that's going to be the new normal, in that hopefully kids, we can instill in them that more of an accountability, more of a responsibility as well of that resilience of being better, right? I think it's always been exciting. I think even more so now that we are going through this.
Absolutely. Jacqueline, do you have any thoughts for, how you're helping your kids adjust to the new normal?
Yeah, so I echo everything that you guys have said so far. I'm excited about the new normal and what that means. One of the things that I've seen at least in my job, is the introduction of things like Google Classroom and Zoom and those types of things into my curriculum, which I had never used before. But that is a great tool, and I'm seeing all the benefits from it now. So in that sense, it is very exciting, because the more people we have in support of this, the better technology and the better advancements we're going to see. I also am excited about the new normal, because students have a voice and they have such a big impact to make. And unfortunately, COVID brought this about, but I think they're realizing now that the actions that they take really do make an impact in not only their school, but in their town as well. And so I really want to encourage them to realize that we have to work together here, and we really need to show up and unite in order to go back to normal, whatever that means. And there's so many different things that the new normal could look like. And something that is kind of a double-edged sword, but it excites me, is that through COVID, we've seen a lot of disparities and like how this has affected certain groups more than others. And it's really brought a lot of things to light, which I think were hidden before. And so I think it's motivated a lot of people to really, put their social justice hats on and get out there and do some good work. And so I'm excited for that, because I think a lot of people are really feeling fueled because of this. And like I said, empower those students, help them use their voices, realize that even though they're 16, 17 years old, they have opinions, they have thoughts that are valid, and they don't have to wait until they're an adult to use them. I want to teach them how to do it now, but they can do it now and do it in the future. So.
Great. Thank you, Jacqueline. That's a wonderful segment as to why I'm excited. I think that the work that HealthCorps has been doing, with the Save the Students campaign, but also with our digital resources and the ability to see where technology will lead us and how we can impact even more students across the country through technology. We've seen an increase in our digital resource uses. I think we're up to over 1.7 million views on some of the digital resources that we've created to really help students tackle COVID, put on a better mental health hat, as Pedram spoke about, be excited, look at the resilience factor, and how they can really look at the future and be excited. And also about being change makers. That's something that HealthCorps has always stood for. And I think some of our new curriculum that we're creating really emphasizes the idea that being 15 or 16 doesn't mean that you don't have a voice and that you can't make a change in your community. Particularly for us as HealthCorps, we really look at the health gap and the health inequities that our communities face, and how do we ensure that our students have the tools and resources to conquer that and not be, subjected to some of the health inequities that they may otherwise be. So I just want to say a huge thank you to all of our guests today. You all represent a microcosm of the work that's happening across the country, and I'm so excited that you were the first guests on our inaugural podcast. The podcast Healthy Chats is available on Spotify and across all of our HealthCorps social media channels. Please take a look at the Save the Student campaign. We would love to increase our reach to over 10,000 students across the country as we work to make sure that our students are safe and healthy when they enter schools. So thank you, Jared and Kinsa. Thank you, Dr. Salimpour. Thank you, Carlos, and thank you, Jacqueline. As Pedram mentioned, it is the first day of fall, so happy fall, and have a wonderful week. Thanks so much. Take care.